Hello everyone, I'm Dr. Vignesh. I'm an ENT and head and neck onco consultant. I also subspecialize in snoring and sleep apnea surgeries. Today I'll be talking to begin with pediatric OSA, that is pediatric obstructive sleep apnea due to hypertrophy of the adenoid and tonsillar hypertrophy. So what is this adenoid and tonsils? These adenoid and tonsils are lymphoid tissue. Adenoid is a lymphoid tissue behind the nose and tonsil is a lymphoid group of lymphoid tissue in the oral cavity. Usually for children between 5 to 10 years, there will be overgrowth of these tissues in the nasal and oral cavity, which obstructs the nasal breathing and also their airway during sleep. So what are the symptoms when they get infected? One, the kid can have nasal discharge. They can have ear pain. One of the most common cause of ear pain in children is secondary to adenoid infections, which causes ear infection known as acute suppurative otitis media. What are the other symptoms of adenoid hypertrophy? One is mouth breathing. Kids, if you are observing the kids having mouth breathing during the night or snoring during the night, it's imperative to rule out adenoid hypertrophy, as is one of the commonest cause of obstructive sleep apnea in children. So tonsillar hypertrophy, that again can be one of the leading cause for obstructive sleep apnea and can deteriorate patients' quality of life. So what are the other symptoms? So one, we discussed about obstruction to nasal breathing and obstruction to their breathing during the night. And these kind of infections can lead to recurrent and repeated ear infections. They can also affect the children's dentition. Because of the constant mouth breathing they're going to have poor dentition. They'll have recurrent tooth infections. They can have recurrent lower respiratory tract infections as a consequence of upper respiratory tract infections, and they can also have poor growth, and they can have a facial growth affection because of constant mouth breathing. Their palatal, and they can have skeletal abnormalities, upper facial skeletal deformities secondary to constant mouth breathing. So what we do as a ENT consultants when you get a patient with these symptoms? First, we want to rule out these allergy, because another common cause of adenoid overgrowth or tonsillar overgrowth is allergies. So generally we rule out allergies, whether it's because of allergy or whether it was because of infections. So kid might require an X-ray of the nasopharynx because they are not cooperative for an endoscopy to visualize the adenoid hypertrophy behind the nose. So once we get an X-ray and once we examine the oral cavity to see the tonsillar size, we get to have a clue how big the problem is. Once we assess the extent of the issue, the kids can be managed medically or in the form of surgeries to reduce their size. In form of medicines, patients may require a steroid nasal spray. They might require antibiotics to treat the underlying infections for prolonged periods of time. If the infections are repeated, if they get more than 3 to 4 episodes a year, or if they are having recurrent ear infections because of adenoid hypertrophy, or if their sleep is getting disturbed because of obstruction to the nasal air passage, the kid may require a procedure either to remove them in the form of coblation or a debrider, which nowadays are painless with the advent of endoscopy and the newer technologies. And the kid may also require a tonsillectomy if tonsils are the source of infections. So what are the precautions which we can take to avoid these infections? One, if there is a family history of allergy, the kids need to avoid excessive exposure to dust, excessive exposure to agarbattis and perfumes, which might be a trigger for their allergy, and proper nutrition and proper exposure to sunlight, as decreased exposure to sunlight and vitamin D deficiencies can increase the chances of upper respiratory tract infections. When it comes to, is there any other form of modality of treatment for these kids? No. Apart from medical management and surgical management, there is no other management as such which we can prevent. Other thing they can do is probably take vaccination for influenza to prevent recurrent viral infections. Every year there will be a new variant of influenza vaccine which they might take, which can to an extent decrease the chances of catching a common cold or a common flu. So what are the outcomes of surgery? If the kid requires a surgery, first and foremost, and if the kid has to undergo the procedure, usually the chance of them coming back for an adenoid is very negligible, and for tonsils, it's 100% no. Once we remove the tonsils, there's no chance of kid having a tonsillar overgrowth again. So is there any negative side effects for doing these surgeries? Yes. What are those negative side effects? If the surgery is not done correctly, yes. But usually now with the advent of the newer technologies, the side effects are what we commonly assume to be. One, there's a false notion that kids' immunity might be affected. There's a false notion that kids' swallowing might be affected. So depends on the condition. If the indication for doing this surgery is because of a nasal obstruction and because of a disturbed sleep, it's going to benefit the children more than causing any harm. Any surgical procedure is always benefit versus risk. If there's more benefit to the patient than the risk, that's the only time where as physicians and surgeons, we are going to advise the patient to undergo a procedure. When there's more risk than the benefits, definitely we are not going to advise that. If you have any more doubts which needs to be clear, kindly pay us a visit to clear more doubts about that.